Hello everyone, my name is Shanmas Chua Baldivia and I am a nursing student from the NESCOS and I am going to perform the eye installation. Definition: administration of medication to the eye. Assessment: Number 1 is assess the patient for any allergies, check explanation date before administering medication, assess the appropriateness of the drug for the patient, review assessment and laboratory data that may influence drug administration, verify patient name, dose, route, and time of administration. Assess the affected eye for any drainage, erythema, or swelling. Assess the patient's knowledge of the medication. Objectives: to directly apply the medications to the eye to provide means for eye evaluation to obtain desired therapeutic effect. Equipment: the equipment are gloves, medication, tissues, normal saline solution, washcloth, cotton balls or gauze, and also a medication administration record or medication card. Step 1. Gather equipment. Check medication order against the original physician's order according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify errors that may have occurred when orders were transcribed. Step 2. Know the action special nursing considerations, safe dose ranges, purpose of administration, and adverse effects of the medications to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder and can also be used to educate the patient about the medication. Perform hand washing to prevent the spread of microorganisms. Place medication on a tray or move the medication cart outside of the patient's room or prepare the administration in the medication area. Organization facilitates error-free administration and saves time. Transport medications to the patient's bedside carefully and keep the medications in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medications. Identify the patients by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain procedure to the patient to gain cooperation and to allay anxiety. Offer tissue to the patient. Solution and tears may spill from the eye during the procedure. Cleanse the eyelids and eyelashes of any drainage with a washcloth, cotton balls, or gauze moistened with normal saline solution. Use each area of the cleaning surface once, moving from the inner toward the outer canthus. Debris can be carried into the eye when the conjunctival sac is exposed. Using each area of the gauze once and moving from the inner canthus to outer canthus prevents carrying debris to the lacrimal ducts. Tilt the patient's head back slightly if sitting, or place the patient's head over a flow of if lying down. The head may be turned slightly to the affected side to prevent solution or tears from flowing toward the opposite eye. Tilting patient's head back slightly makes it easier to reach the conjunctival sac. This should be avoided if the patient has cervical spine injury. Remove cap from the medication bottle, being careful to not touch the inner side of the cap. Touching the inner side of the cap may contaminate the bottle of medication. Invert the monodrip that is commonly used to instill eye drops. Have patient look up and focus on something on the ceiling. By having the patient look up, the procedure is less traumatic and keeps the eye still. Place thumb or two fingers near margin of lower eyelid immediately before eyelashes and exert pressure downward over bony prominence of cheek. Lower conjunctival sac is exposed as lower is pulled down. The eye drop should be placed in the conjunctival sac, not directly on the eyeball. Hold dropper close to eye but avoid touching eyelids or lashes. Squeeze container and allow the prescribed number of drops to fall in lower conjunctival sac. Touching the eye, eyelids, or lashes can contaminate the medication in the bottle. Startle the patient causing blink or injury the eye. Do not allow the medication to fall into cornea. This may injure cornea or cause the patient have unpleasant sensation. Release lower lid after eye drops are instilled. Ask patient to close eyes gently. This allows the medication to be distributed over the entire eye. Instruct the patient not to rub affected eye. This prevents injury and irritation to eye. Perform hand hygiene. Hand hygiene deters the spread of microorganisms. Assist the patient to comfortable position. This ensures patient comfort, of course. Evaluation. Patient cooperates with the instillation of eye medication. Desired therapeutic effect is obtained. Experiences no adverse effects including allergy response, systematic effect, or injury.